Okay, maybe we'll get started. Hello, welcome. Today we're going to be going through what non-insured health benefits or NIHB is. And today we're really going to focus on what you need to know in practice. So my name is Beth Finn. I'm one of the Indigenous liaisons here at the Calgary zone. I am a member of Buffalo Lake Métis settlement, but I grew up here and my background is in social work. And I'll give Veronica a chance to introduce herself as well. She'll be monitoring the chat for us today.
Wonderful, thank you, Beth. I'm Veronica Bigplume. I'm also an Indigenous liaison with the Calgary zone. I am from both Treaty 6 and Treaty 7 territories, a member of the Tsuut'ina Nation, and my background is in higher education and leadership. Thank you.
Thank you. And then we also have September Daniels and Tessie Bigplume joining us today from the Stoney Nakoda Tsuut'ina Tribal Council G4 Health. And they are experts in navigating NIHB for their nation members. And I'm so happy to have their support and input today. So I'll let them introduce themselves as well.
You want me to go, September? Awesome. Oh, okay. Well, thank you, Beth and Veronica, for the introduction. My name is Tessie Bigplume. I am Dene from the Tsuut'ina Nation. I have been in my role as the NIHB navigator, currently the health manager, but I've been navigating the system for 21 years, almost 22 years now. So it really does come with time and understanding both the provincial and federal systems as First Nation. So thank you, and I look forward to the presentation today. Thank you. Go ahead, September.
Yes, hi. Excuse me. I have a cold, but bear with me. I'm both states and is a good job. My name is September Daniels, and I'm from the Tsuut'ina Nation and the Stoney Nakoda Nation. I have, excuse me. I have a dry throat here. Sorry. I'm a health client navigator. So what I do is I actually am the frontline worker to navigate the system for our people, for the four nations that we support. And my role is to be the voice for our people and to have them access the benefits of NIHB and explain things better to them so they can better understand what the benefits are and how they can utilize it. But yeah, thank you so much for having us. And then, and I'm looking forward to this presentation as well.
Oh, thank you. So if anyone has questions at any point throughout this presentation, feel free to add them to the chat or just speak up. We kind of want this to be like more conversational. So since we only have about 45 minutes today, hopefully we can provide like a good basic overview and help us determine what is needed for future sessions. So we're going to start by giving a quick overview of what NIHB is. We'll walk through what it covers and the most important, relevant things to your work, and then touch on what's not covered and some of the confusion with that, and then go over some challenges that you'd see in practice, and then what you can do to support your patients. And we'll also send out some resources at the end. So, like I said, this session is just meant to build confidence, not expertise. So you don't need to memorize everything, but you should leave knowing how to recognize when NIHB applies and how to support your patients. So, non-insured health benefits is a federal program delivered through Indigenous Services Canada. It provides coverage for certain health-related services for eligible First Nations and Inuit clients. So specifically with things that aren't covered through provincial healthcare or private insurance. And it's meant to fill the gaps in the system. So NIHB can directly impact whether a patient is able to access medications, get equipment they need, or engage in mental health supports. So it often shapes what treatment options are accessible for patients sitting in front of you. And it also plays a role in reducing financial barriers. So without it, many patients would have to pay out of pocket or go without care altogether. At the same time, it's important to know that navigating NHB isn't always straightforward. So that's why we have Tessie in September with us today to kind of provide nuance and details that you can't find kind of online. So many patients experience confusion or delays and frustration with the process. And even if you're not kind of directly involved in billing or approvals, you're still often the first point of contact and can help by recognizing when NIHB might apply and helping patients understand their options. So, who is eligible? This is pretty specific, so it includes registered First Nations individuals under the Indian Act, and Inuit individuals recognized through land claim organizations, as well as infants under 24 months if a parent is eligible. Something to also keep in mind is Métis individuals are not covered under NHB, which can create some confusion. So it's always helpful to ask and not assume. September,
Can I add? Yeah, I was going
Yes.
to jump in before you go into the next slide. So with the children that are, the children that are eligible for 2 years and over, but I think professionals and support givers have to know that one parent has to be one treaty, like that's how they're eligible as well. And then we always encourage that they need to register baby as soon as possible because sometimes it depends on what nation they're from. The ban can take quite a bit of time to get them on the ban list. So that's always a barrier for people. So we always encourage new parents to make sure that they register them right away. And then the other thing too, like I said, like the other parents have to be treaty to be eligible for our children that are up to 2 years old.
Perfect. Thank you.
I also just want to add, because we know sometimes there's a little bit of a complex cases with their number. So even if the individual loses their number, they can contact the Alberta region up in Edmonton to get their number. So just in case if somebody did lose their number, as well as like there's the Friendship Center where they can get some of their like there's treaty number as well, or the surrounding band offices. Just depends where you're coming from, but there are different resources that they can re-get their card. Veronica?
Yes, we just have a question. Is it okay to have one parent registered or not?
Yep, that's what we're saying. As long as they have their treaty number, one of the parents, they're able to access NHB. And then even if say the child is over 2 and the parents have applied, getting supporting document saying that they did apply, they are eligible for a temporary number in that meantime until their regular number comes. That's a little bit of paperwork and calling around, but that is doable. So even if you were to support a client or member and they're like, oh, well, they don't have a number, they're past 2, but then the parent has registered the baby, then we are able to support that too.
Perfect. Thank you. Okay, so what does it cover? So this is a bit extensive. We could probably spend days on this, but just to break it down to a manageable time time, if you prescribe it, recommend it, or refer to it, NIHB probably touches it. So medications and medical supplies like prescription drugs, over-the-counter medications, medical supplies like walkers, mobility aids, respiratory equipment, hearing aids, dental care, preventative and restorative treatments, and emergency dental services, vision care like glasses or lenses, and repairs or replacements, short-term mental health counseling and crisis intervention sessions, medical transportation, so medical appointments when services aren't available in the community, and also accommodations and meals when approved. And
So just to
September,
add, just to add to that. So with the mental health support, like they're eligible to go, if they went over 22 hours, they are eligible to extend it. And they can utilize it more as long as they're seeing their psychologist or counseling, and then they can get their information from them, and then they can extend hours for them. That's one thing that the people are not aware of. And then the medical transportation is a huge thing that we always have to deal with because our people do utilize it a lot more. Like there's so many people that go in with their families into hospitals, and they have to assist them with, especially with the language barrier and our traditional ways that they want to get some, I would say, meals and then mileages, but we have to make them apply under the escort, it's called. And then we have to submit that for them so they can have access to meals or even transportation or the mileage to take their loved ones to doctor or to the hospital. And sometimes that's kind of a barrier because we have to justify that why we have to be with our families going into these medical cares and centers and be with them. Someone had their hand up there, Veronica.
Yes, we have a couple questions here. Is it 22 hours per year or total?
Yeah, it's 22 hours per year total. Yeah.
Okay.
I
And
also
then
just
another-
want to say, yeah, go ahead, Veronica. I'll let you finish.
Oh, sorry about that. Another question is, any physio, massage, or chiropractic coverage?
No.
No, that's excluded from the policy, so you can't even appeal it or anything like that.
Okay, I got a couple more
I-
questions.
I-
Sorry
yeah.
about that.
That's okay.
Go ahead,
I
Kathy.
just wanted to mention that these are the main areas, but they are broad on paper, and each of these categories, benefit areas, have specific criteria and limitations and approval requirements, like for all 6 areas, as well as I want to mention that pharmacy and dental are ran in headquarters, which is going to be in Ottawa. And those are the 2 biggest benefit areas that NIHB has. So it is very broad, but each area is really kind of has their own pathway. And like September said, like majority of our people utilize usually about at least 2 to 4 of these benefits, like when they go to an appointment, majority of the time. So for us to, just for an example, so I go to an appointment, that's medical transportation, and then I pick up then I'm prescribed some pharmacy stuff, then I got to go to the pharmacy, so that's another benefit. And then sometimes I'm going to maybe depending on the situation, I'm going to access my mental health counseling. And there's different ways that could be supported as well, because there's a rate and it's $187 an hour. So anything over and above, and we know that's kind of not the typical rate. What is people like, majority of the counseling services are usually $200 and over. So sometimes and in that area, you would probably want to contact September or myself or a navigator to see if there is going to be a list of service providers that they can provide, or even do a referral and say, well, there's this person that works with NIHB, so then they're not having to pay out of pocket for any of these services. So yeah, and that goes for all of the benefit areas. So if you need something from those areas and you have a client or a patient that needs support from NHB, you guys aren't sure if that there's any providers in the area that work with NHB, we'd be able to help navigate that for you. So yeah, it's pretty big. Like it's not small. And we can probably talk about each benefit area, their criteria, really the limitations, because sometimes you will be told no, but it might just need a supporting document, a letter, even some blood work, x-rays, another support letter, like, it is kind of a bit of a process. So I just want to add that. Thank you.
Thank you so much, Tessie. We just had a couple extra questions here. And to get the mental health coverage, does it have to be by an approved provider? And a second question, is it 100% coverage or a certain percentage?
With the mental health.
Yeah.
Oh, no, go ahead, Tessie.
No, go ahead.
No, I was going to say it is 100% covered, and it has to be an NHB provider. So that's where mostly there's a lot of counseling services do have the listing, but not all of them. So like the clients do have to do their part too. And if they want to go through counseling, they have to make sure that if they're NHB providers, but they are fully covered for 22 hours.
But in addition to that, so if you know anybody that that wants to sign up as a provider on Express Scripts, they can actually follow through that process and be listed as a provider as well, as long as they meet the requirements to be a provider. And again, that's going to be in the package on Express Scripts too.
Okay. So we might have covered some of this already, but pharmacy is a really popular option for questions, but it also covers like common over-the-counter items like Tylenol, Advil, gauze, condoms, as well as medical cannabis. So that's one of the really big areas where it's different from provincial or private drug plans. Prescription is still required for those. So you might see renewals for over-the-counter products. And not all medications are automatically covered. Some are open and covered right away. Some are limited use, meaning other criteria has to be met, or some have exceptions which require additional approval. So these can all create delays and frustrations if it's not anticipated. Yeah. And I know September had some experience with pharmacists and educating on that as well.
Yeah, I'll just quickly touch base on that and then we can go to the question. So what I have been doing since I've been in this role is like I've been practicing to utilize pharmacies. And then the pharmacists, I've been asking questions about NHB, and they had no clue what the process is with NHB. They have it in the system, but they didn't realize it that there is a listing too that's over the counter that our people can just utilize without going to the doctor and getting prescription for it. Like even with that, we educate our community members to make sure that if they like something the Tylenol or children's Tylenol, that's something new that maybe it's been there for years, but we didn't know as well. So those are the things that we try and teach our community to make sure that they ask these questions as well. And then plus to go with the pharmacists, I'm actually educating some pharmacists to make sure that they help our people in this way and to make sure that they look into the NHB listing first before they make them pay into with their own money. But go ahead, Veronica.
Yes, we just have a question. Would nutritional drink products like Ensure be covered?
Cassie, maybe you can answer that.
Can you read that question again? Sorry.
Yes. Would nutritional drink products like Ensure be covered?
Yes, it would be, but as long as they meet the criteria. So there's a limited, there's different reasons why an individual would. So then again, it would just be filling out that paperwork. Sometimes I've helped clients indicate like that's like they're not able to eat due to some dental surgeries, diabetic needs. There's all these different needs, but that's going to go into limited use option for coverage type. So it is going to be a little bit different sometimes. So again, it's going to meet criteria before it can be covered. So I mean, it never used to be before. I used to see a lot of denials on this, on nutritional drinks, but it's a little bit easier today's for to access. So, yeah.
Okay. So we covered some of this already, and I think Mary clarified in the chat. So yeah, clients can access 22 hours per year of mental health counseling for individual, family, or group sessions. Additional hours can be approved depending on need. And Psychology Today is a really good resource as well, because you can filter providers that direct bill NIHB as well. So if anyone has used that website, that's a good option. And then,
just want to mention that we have a list that is shortlisted with specific criteria. So, there's with different specialties. So, with a lot of different trauma our First Nation people have faced. So there's going to be residential school supports. There's going to be some neurodivergent psychologists that are going to be listed on ours. And I feel like sometimes like with these specialties, because they weren't listed before, and so a lot of our patients not patients, but clients, members have questions of like who, because they've tried so many other ones and then they're kind of missing those pieces. So we developed that short list for individuals that are really specific and have the experience working with their people. So I just wanted to add that. And then also in the comments, you are right, Mary, but majority of the time, our people really can't afford to pay out of pocket and wait for the reimbursement sometimes. So we usually try to make sure that the person is enrolled with NIHB, so they can, so then the service provider would be able to submit billing that way and then get submitted as well. So, thanks.
Okay. So moving on to medical supplies and equipment. So this includes things like wheelchairs, orthotics, oxygen, hearing aids, and wound care supplies. And an important thing to know about these is they require prior approval. So if you're planning discharge or recommending equipment, it's helpful to consider timelines and approvals earlier to avoid those delays. September or Tessie, did you want to add a little tidbit?
Yeah. Sure, yeah. I think one of the importance with the medical supplies too for mothers is the breast pump. Like that is covered through NIHB, and that's pretty actually easy accessible, because I personally just did that with my daughter's first baby, and it is a process to do, but once you have that support from their own community healthcare too, like for me, if I'm helping someone as a navigator, I would definitely like totally get them this right away. But if like say if it's someone that if I'm not there and they have a nation medical clinic that they can go to, like for instance, Sutana's pharmacy, they're well aware of these NIHB that's covered through the breast pump and with the formula as well. So the formula is provided too. They just have to get that prescription, just like any other ones, and get that supporting documents. And then young moms can actually access the breast pump and formula.
Yeah, and then in some complex cases, I've helped support individual with their electric wheelchair was on back order because COVID. So the supplier was coming in from outside of our region, and they were able to get a temporary one through Red Cross, but that took a little bit of time, as well as some of the limbs. I've helped so with some artificial limbs, supporting clients like that. So it's really broad again for our medical supplies and equipment, because it goes into like breathing supports and machines, the walkers. It's very big, and even for some of the in-home supports for the clients as well, so is really great for this benefit.
We just have a couple questions. Is it temporary breast pump that's covered or a permanent one? In other words, is it a rental? And second question is, CPAP machines at all possible?
With the breast pump, it's actually purchased for her, so she gets to keep it. So it is fully purchased with that I know of right now. With the CCAP machine, I think Tessie's can answer that, if that's possible.
I can look into it. I know, I want to say yes, and there's different models that would be. So if you have really specific client case, it's going to be case by case, again, meeting criteria. So I don't want to say yes, and I don't want to say no. So and that's, I don't want to sound really governmenty or anything, but that's kind of, it's going to be case by case. So I have seen them, yes. And then I've also seen some that weren't provided. So sorry if that doesn't really clearly answer your question. Yeah.
Yes, we have another question here. Oh no, sorry, Mary clarified that. Go ahead.
Perfect. Okay. Yeah, I feel like there's a lot of case by case basis. And then, so what is not covered? Again, we could go on for days. But this is where a lot of confusion comes up as well. Like not all medications are automatically covered. Some require review or appeals, especially if they fall outside of the standard drug list. Also, it's usually the lowest cost option, like the generic version, that are covered. Travel is another kind of sticky area where there can be limitations. So medical transport, but not all travel-related costs are approved. Some of the common exclusions are like dental implants, fertility medications, weight loss medications, and cosmetic procedures. But if something isn't covered, it doesn't mean there are no options. It just might require some other steps, advocacy, appeal, or exploring alternative supports. As we just kind of covered, like travel is really sticky. I don't know if September or Tessie has any little travel stories or
Yeah, I think it's going to depend. I want to say there's two ways to access, when you have an appointment, they got to leave community to go to their appointment. So medical transportation is going to be organized for them. And again, it's gonna, as soon as you know the appointment, to put that request in, and it doesn't have to come directly from the health center in community. That could be done within region. And so the individual or you as a healthcare provider could help assist with that and just fax that confirmation of appointment. And even if they are in town on and off reserve, because NIHB is portable regardless. So sometimes it will require a little bit of advocacy for the client, because sometimes you'll be told no, and then be like, okay, well, I'm going to appeal it. And I really encourage everybody, if you are told no, to appeal it, because the more that we appeal it, the better for us, because then we can influence policy change around that area. Or if you're not even sure if once they get the denial, shoot an email to us or a phone call, and we'd be more than happy to assist with the appeal process. And then even explaining like it could be just the criteria, and then we work with the service provider and client and try to eliminate those barriers for the client to access the benefit. Another travel I've seen within the medical transportation framework would be a traditional healer. So if you have a client that is going to get doctored, they are eligible to, within the borders of Alberta, can access that benefit area. Or if the client is in hospital and they're requesting doctoring from a healer, that healer could get support to come and do that through meals, mileage, and accommodations as well. So it's gonna vary depending on what the client's needs are, but those are our day-to-day supports that we really do provide. So the sooner the better for medical appointments that the client knows of. For those emergency ones, again, like in hospital doctoring, we are able to kind of coordinate that and push that process through in a faster setting. What else have I seen? I've also seen some people where NHB is like, oh, they missed too many appointments. Sometimes that needs advocacy because NHB doesn't know the geographic area that client is coming from or why. So then we have to step in and advocate and let them know their missed appointments because of the weather. They don't have, like, sometimes the reserves don't have the infrastructure to plow, so we have to cancel that appointment, but they don't see it. So again, sometimes it's just a bit of advocacy if you are told no, and then just reach out to us as much as you can if you have any questions regarding the 6 benefit areas. But I do want to say for fertility and weight loss and cosmetic, those are out of policy and those cannot be an appeal. And they're not even listed on anything. So that's how I see that going with that. So if it's not on the policy within the 6 benefit areas, it cannot be appealed. So yeah, I'm trying to think of other ones here. Medical bills and coverage outside of Canada. For seasonal workers, NHB would cover them. For our students, NHB would cover them up to an amount for a premium there. So, I mean, it is very complex when we talk about NHB because, again, sometimes you're going to jump on the phone, call NHB, or even read the policies and interpret it, and it should be covered, but then somebody from NHB will be like, no, it's not. So it's really trying to, I guess, navigate it, because even me within my role, sometimes I will get an interpretation where I'm like, well, in the policy it says it's covered, so then I always have to provide pushback with that, and then yeah, it's pretty tough because then it goes into them saying that, like, well, it's covered through the province. So we have to navigate not just the federal system, but also the provincial system. And they kind of point fingers together. So that's why we kind of make sure that we have our documents, because no, that's not covered. And it is last resort, last payer resort kind of thing. So if they say, well, like, and there's always that kind of pointing fingers I find with that. So we're here to help through that process and navigate through that, because that's our day to day. So I see Amy's question is, what is a typical wait time for an appeal? I'm going to say they, as in NHB, it says 28 days. Sometimes it's before that, sometimes it's after that. So it's typically about 28 days before them. In a perfect world, we know that doesn't really happen, but if they have Express Scripts Canada, clients can sign up with that, and then their notice would go into that their mailbox in there. So that's a faster way, actually, when a client does a reimbursement or an appeal. That portal there is really great for that. But we know that not a lot of people are like, especially our elder population, they aren't really some, I guess, are really great with the apps that are out there. So we usually just try to I guess, I don't know, like I even have it, it's not the best, but all the information could be on there faster than mail sometimes, because again, depending on your geographic area, I know I live in Bear Creek, and my mail usually comes like a week and a half later than the regular mail that is sent out. So there's all those delays. It's not really modernized yet.
One day. So we covered some of this already. How does it work? So yeah, NHB was designed as like a pair of last resort. So in theory, any other available coverage like provincial health benefits or private insurance is used first, and NHB covers what's left. But many Indigenous patients, NHB is their only source of coverage. So it functions as the primary support for many people. It's also important to recognize that the health benefits are tied to inherent Aboriginal treaty rights, which are constitutionally protected. So it's connected to broader rights and responsibilities. So the patient's treaty card or status card is their benefits card, and that's what providers use to confirm eligibility and then bill NIHB. So it's typically covered 100%, no co-payments or deductibles, reducing financial barriers. And again, like behind the scenes, Express Scripts Canada manages most of the claims processing for NHB. So providers use their website to access the drug benefit list and check coverage and find billing information. So yeah, many providers like pharmacists, dentists, optometrists, and mental health professionals need to be registered with NIHB in order to bill directly. And then the patient don't have to pay it up front. What else? Yeah, there's like not everything is automatic, like Tessie was saying. Those approvals can take longer, but if they have an account with Express Scripts, can speed it a little bit. September, did you want to add something?
Well, just as a client navigator, like I just want to say that if anyone, your patients or people are willing, like don't want to do it themselves, navigating through this website, like I come in and I assist them with that. Like I'll get them signed up with Express Script and then get them through the process and get them to understand it, and I can sign them up as well.
Awesome. Okay, so moving forward, let's see.
Wait, before you go forward,
Okay.
Mary asks, can you work with folks who are not from a G4 nation?
Yep, we can. Yep.
Wonderful. Thanks so much.
And I just want to say, like, the common barriers we see in navigating the system, the health system for a long time, I really find that it's the recurring systemic issues within the policies. So, there's a difficulty understanding coverage in all the 6 benefit areas, the communication gaps between the providers to our clients. We have, again, the provincial coverage and regional inconsistencies in their interpretation. It becomes a really big problem. And then the prior approvals cause a delay for the client. So we really try to eliminate that ahead of time. So creating like these really quick pathways for them, we've been great at doing.
Mind you, sometimes, again, case by case, but sometimes they just need a little bit more information. And the biggest one I find is the interpretation, because not everybody speaks policy every day, right? So that's really big. And then how to simplify it for our members accessing it. So like the Q&As, how can we start to build their confidence up when they go into the health systems, asking these questions about like, hey, do you guys work with NHB? Those are really big questions. It doesn't matter whether it's going to be dental, mental health. I really want to say our biggest one again is like that we do utilize and should be utilizing is the medical transportation, because if our client is going through an appointment, they can go. And then they can also, another option is get reimbursement. So they should be able to get mileage depending on the type of appointment. They can get meals and accommodations if they fit within that criteria as well. But tips for successful navigation, I guess, would be really to submit all of the requests early, as soon as possible. Doesn't matter what it is, in those 6 benefit areas, and use strong medical rationale, because then it doesn't leave a gap for NIHB to be like, a delay or question certain things. It's as long as it's really strongly written, I find, or have some keywords, and that will come with experience. And keep all records of communication with NIHB as well. Like even if you were to document it, that email, because that's what we do as a wise practice. And just kind of like, so we can actually inform them sometimes too, like we've been working on, we requested it this date, because it is a large volume sometimes, but even just saying that could speed up the process for that. And getting them to clarify the denial reasons in writing. So that's really big. And if you guys have any cases where it is denied, just send us the whole file or documentation for us, because that really helps us to advocate for that appeal process, or even even help walking you through that process. So maybe if you have another future client, you'll already kind of know what steps to take with that, if you want to do it on your own, or if you have the client that want to do their own appeal process as well, trying to build that. But yeah, so I think those are the really big ones. And the language, if you have a Tsuut'ina or a Yithka client, September is fluent in the language, so she's able to help with that language barrier. So that's an amazing one, because I really think we should have more of those of September in the roles to really help. And even with like appointments and how understanding new diagnoses is really beneficial, because we know sometimes that could be very overwhelming, or even just navigating that system. The health system itself is overwhelming when you're not feeling well. And I think that's the biggest thing, is having somebody to walk with you on that journey. And once we've helped the client, we always get like a couple more, because then they end up we end up helping their family, their nieces, nephews, grandparents, or whatnot. So we really try to build relationship with our clients for long term. So we have recurring clients all the time. So, and even service providers have been really great of helping us, I guess, write support letters for the like within the policy, like, and how harmful it really is. And we've been great doing that and building that allyship as well. Yeah, so I think that's kind of who you guys need to contact. It would be somebody from me or September to help navigate any questions for the policy. We actually also have 4 First Nation client liaisons in for the communities. So 1 in Eden Valley, 1 in Minithini, 1 in Tsuut'ina, and then 1 in Bighorn. And then we have September at the G4 Health Office and myself. So there's a lot of people that could help answer any questions you guys might have in the future, or
or you can even let your clients know as well. But is it okay if I ask the group, like what kind of barriers do they see accessing NIHB? That's a question for the group. So if anybody wants to answer, that'd be awesome.
My experience in the past with NIHB is even to get started, like they don't know their status number, or have their status card, so they don't even want to bother because they feel like it's going to be a long wait. So it's good to know there's a number in Edmonton I can call with them to get their status number. That's really helpful. But yeah, I think that's the main one I've seen myself, but I don't know about anybody else.
Oh, that's fair. That's fair because like you definitely need that number to access NHB, and not to be real like rain on this beautiful day, but honestly, like that's the systems we have to navigate, and it's so frustrating because even if you were to read the policy, it's systemic racism in there, and so it's always that pushback we have to go against. But that's what really fires our passion here at G4 Health, is like being that advocate for our members, because we know like that's a common question we get all the time, is that, oh, it's going to take too long, I give up right away before, right? So then even if we have our treating number and we go to access a benefit, it's like, oh no, it's denied. But sometimes it could be just missing a supporting letter. It could be, oh, well, I didn't know they met the criteria. So it's like, well, actually, the client has multi-diagnosis, right? So for vision, example would be, if somebody's health status is changing from their last exam, they can get an exam covered because their health status has changed. So again, that would be from another doctor to another doctor, but getting that submitted for coverage. So there's just like different tips and tricks per benefit area that we run into. And that's the sad reality, is they give up before because they know it's so complex. And again, that's why we say as soon as baby's born, get their treaty number, get their number. And then even if they lost their number, depending on the cases, call that number, even their health center, even their band office, to get that number. It doesn't have to be that region office, but because yeah, there'll be a whole process with that. But even if you start to just use that as a wise practice for future clients, that'd be good, and get them their card again. Because if there is a friendship center, they have like the ID clinics through Indigenous Service Canada. So even if you share that information with them, when their next clinic date is, their ID clinic date is, because they do it for free there, and they'll get their card again. A reissue, yeah. Anybody else have any barriers that you're seeing, or what trends are emerging within your work with NIHB? It could be collaborative improvement outcome. I'm just curious to understand what your guys' day-to-day interaction with NIHB is.
I'll just, oh, sorry. Hi. Sorry, it's Mary here. I'll just say the biggest barrier I've seen so far, and Tessie, I'm more along the lines of in a similar role as you, where I'm helping folks navigate these resources. So the biggest barriers I've seen is just like providers not being aware of what can be accessed through NIHB. And then so they'll like refer to another program that then comes back and says that patient's not eligible because they need to access NIHB first. So like, for example, Alberta Aids to Daily Living, they'll like, a patient needs a walker and they'll do a referral for a walker, and then the patient will wait forever just to be told they're not eligible and they need to go through NIHB. So barriers like that, where people aren't aware of what's available and which program needs to be accessed first. So those are the biggest barriers that I've seen. So I just always, the providers I speak to, I always say, like, if there are resources your patients are commonly accessing, like, you don't need to be an expert on NIHB, but I'd suggest you familiarize yourself with those common resources that your patients are accessing. So for example, if you're working with new moms and babies, like be familiar with the policy or the referral pathway for getting a breast pump. Or if you're working with folks who are often having to access mobility aids, then make sure you're familiar with the criteria for that. So those are the biggest things that I see on my side, Tessie.
No, that's great. And as you know, like each benefit area has their way of communicating the updates. And honestly, I find the policy changes so much, we can't keep up, right? So it's like even if something wasn't covered 2 weeks ago, today it could be covered, but we won't know until we look into that. And I think that's the biggest thing is it's so complex, and it's like, and then even finding that when you interpret it, it's like, so is that covered? And then you go back and they're like, well, no, it's not. So it's really like trying to, oh, it's frustrating. And so I really help try to simplify those updates as well as we get quarterly updates, and it's kind of broken down. It's on the website too, so anybody can sign up. So maybe if you want to encourage those service providers to sign up with NHB so they directly get those NHB policy updates, would be a really good good way to kind of keep informed. However, really depending, sometimes even the codes have changed where it looks like it's no longer a listed item, but the code's changed, and it could be a better, newer medication. Or I've seen some of the like wheelchairs and stuff. Some of the I don't want to say like a tune-up, but like sometimes that's been done. Like, so if there's like no longer those pieces available, then they'll be able to get a new wheelchair just depending on that. Or I've seen some parts, yeah, like just those updates. And I really think that would be good because again, even to start is like, okay, well, we can't cover that because sometimes NHB will go back and say, well, no, daily living is supposed to cover that. But then even if you were to get that denial from that program, so NHB knows, no, you're not going to waste any more time trying to go back and forth to the province programs. And that's where I find that the client falls through the gap, is between those two things. So as soon as you get that, and they say that and say, can I get a letter? Because then it's just going to speed up NHB's process, or vice versa. Or if NHB gives you a denial saying that it's not covered, at least the province knows that the federal system's not going to cover this, and then the provincial should cover that. So I've done those things. I've had a client in hospital with wound care, but the facility was no longer able to support the wound care supplies. So I contacted medical supplies and equipment, and they're like, no, we're not going to cover that because she's in a facility, so they should be providing it. Okay. My next step, what I did was contact the financial CFO of that program saying, can you write me a letter and say that it's not going to be covered? It's out of, it wasn't in their budget or whatnot. So that person did, and then I sent it to NHB. Then NHB was able to provide the medical supplies and equipment for that patient that was in there. So there's just a bunch of different scenarios when it comes to NHB, and that's where sometimes even the miscommunication comes from the NHB program, because a lot of it is going to be turnover, or they don't know they don't know the policy themselves. Sometimes I was like, I swear to God, that's how it is sometimes. But yeah, it's like there's always all these nuances with NHB. So I mean, ideally, as soon as you get a no from one of the programs, get it in writing. That's the first step all the time. So all right, just because it speeds up the process for any of the programs. But yeah, I mean, I really appreciate and knowing the barriers that everybody's seeing, because it really does it really does help us try to kind of bridge some of these gaps. And how can we bring more information education, not only to service providers and health professionals like yourself, but really ideally for our grassroots people, so they can access and exercise their treaty right to health with this program. And I will be sending out the new NIHB policy updates, as well as I have created a NIHB summary sheet with each benefit area with each numbers, a little bit of a cheat sheet of rates that are covered under each category, and September and myself information to reach out.
Okay, we are almost at the end. Yeah, just to reiterate, you guys are not alone. We're here to help. Veronica or I, Tessie, September, reach out if you need help, and we'll be sending out resources after this training as well. For anyone who is still here, there will be a survey attached to the email, or you can click the QR code here. That just helps us know what we'd like to see in the future. And yes, thank you so much, everyone, for coming today and for all the work that you do. And yeah, thank you.
Thank you.
Thank you.
Thanks.
Have a good day, everybody.
you.
Enjoy the sun.